So, as we already know, semen parameters, many times, many couples, they get their semen analysis done, then they are just thinking, okay, what is the report? Is it bad? Is it good? It's not just like that. There are so many parameters are there that we have to look in that semen analysis report. There is volume, there is count of the sperms, the motility of the sperms, the morphology of the sperms. Morphology means how are they looking? If we look at them under the microscope, how are they looking? Are they symmetrical? And do they have the normal structure like the head, the tail, or they are abnormal? So that thing is called morphology. Vitality is how many of them are live actually. Many of them can be dead, though the counts can be good, but none of them may be alive, or all of them may be dead also. So these are the things that we actually look in the semen analysis. Similarly, we look at the pus cells. Many a times, semen parameters, everything is good, but there is some infection, and at that time, the pus cells are very high in that semen report. So these things, once treated just with antibiotics, can give you positive results in a very short period of time. Many a times, the only concern is just these pus cells. Everything is perfect, only pus cells are there, and that infection can make those sperms not suitable for fertilization. So that may be the only reason why pregnancy is not occurring. Then this DFI is basically DNA fragmentation index. This is a parameter which tells us that how is the genetic potential of that sperm. Many a times the sperms may be there, the counts may be there, everything is perfect, but when we are trying to inject it in the egg, and when we are trying to make good quality embryos, we are not able to get embryos. And the reason behind that is this high DFI. High DFI is, we have to do a separate test for this DFI, and these are the normal parameters that I was talking to you about. Normally, the volume should be more than 1.5 ml. Sperm count should be at least more than 15 millions. Total motility should be more than 40, and out of this, progressive motility should be more than 32% of the sperms, and vitality, that means those who are, which are live sperms, those should be more than 58%. This morphology I was talking to you about, it should be more than 4%. That means out of 100, if only 4 sperms are also normal looking, then also it is good. But the problem arises when it is less than 4. Many a times, many a times you will see that in the your sperm semen analysis report, morphology is not even mentioned.
Right.
Many low, I would say small labs, they are not even mentioning the morphology. It is such an important parameter, and because it is possible that all the sperms are abnormal, whatever they are moving, they are live, they are counts is good, but when we look under the microscope, they are not looking as normal sperms. All of them also can be abnormal. In that scenario, pregnancy is not going to take place, whatever you do. So that is why I always ask my patients to get a semen analysis done from a very good lab. At least they should have a good microscope, because under which they will be looking at. If you have a very light microscope or not a very good magnification microscope, you will not be able to tell the morphology. So that is also one of the good parameters.